Okay, this is going to be your video lecture on connective tissue. We're going to be reviewing, just like we did the last weekend, some concept, and then we'll be talking about the functions and the characteristics of connective tissue. You're also going to be responsible for the information on types of bones and the cellular component of bones, etc. And you'll see that at the end of this PowerPoint. When you're studying for your quiz next week, make sure you review this PowerPoint as well as the information in your textbook. A lot of the quiz questions will come directly from the information I'm going to cover in this lecture. Okay, so there is no tissue in the body that is as ubiquitous as connective tissue. As it migrates and develops in various forms, in various locations, its connective qualities can't be overstated. There's a very good reason we call it connective tissue. It does bind specific cells into tissues, tissues into organs, organs into systems. It cements muscle into bone, ties bones into joints, wraps every nerve and every vessel, laces all internal structures firmly into place, and envelops the body as a whole. Typically, actually, let me do the next slide and then I'll make that comment. In all of these linings, wrappings, cables, and moorings, it is one continuous substance. That's a really important concept for you to get a hold of. Fascia is the same as bone. Cartilage is the same as ligament. Tendon is the same as fascia. It just all goes into the same thing. One continuous substance. And every single part of the body is connected to every other part of the body by virtue of its network. Every part of us is in its embrace. So one of my big pet peeves as a massage therapist is when another therapist, I frequently hear them say, it's all connected. I don't mind that phrase. I do believe that is a fact. What I mind is when someone uses that phrase without the knowledge behind it to support what they're saying. Oftentimes they're using it as a cop-out. Why are you working on my calf if I told you I have low back pain? Well, it's all connected. Well, if you don't understand the connection, don't tell people that, okay? But the truth is, because connective tissue is all one unit essentially in the body, it is the connecting force. We are all connected by connective tissue. So George E. Snyder, who's a professor of anatomy at Kirksville College of Osteopathy and Surgery, makes the comment that connective tissue not only binds the various parts of the body, but in a broader sense it connects the numerous branches of medicine. And that's very true also. So the look and feel of connective tissue is familiar to any cook. Anyone who has ever made a roast chicken or a Thanksgiving turkey is familiar with that white glossy sac that surrounds every individual muscle in a carcass, in your turkey. The smooth, slick covering over the raw bones, the membranes that encase the internal organs, the lining that line the body cavities, the tough tendons, ligaments, and bursa that cook up into gristle. That's all real connective tissue. So if you've ever made a roast chicken or a turkey, and you made a nice buttery herb sauce that you dip your hand into the herb butter and you slide your hand under the skin and over the meat and you massage that butter into the meat. All that clear film that holds the poultry skin onto the meat, that is fascia, and that's what we're trying to work through and work with when we're giving a deep tissue massage. So the protein collagen, thin white fibers that make up all these familiar sheets and cords, is perhaps the most abundant protein in the entire animal kingdom. It constitutes as much as 40% of all the proteins in the body. Collagen is to animals what cellulose is to plants. So that tough lattice in which all other kinds of tissue are developed and contained, the walls of the compartments which fill with fluids to give a plant its juiciness and its upright turgor, it's all the same thing. So for humans and for animals, that's collagen. In the development of the human embryo, fibroblasts appear as early as the 12th day following fertilization. is derived from the mesoderm layer, which produces tendon, ligament, cartilage, bone, marrow, muscle, blood, lymph, blood vessels and lymph vessels, the surface linings of body cavities, joint capsules, kidneys, ureters, gonads, genital ducts, and the adrenal cortex are all developed in the mesoderm. And if you remember what I told you last week when we talked about embryonic development, I told you that anything that develops within a particular germ layer of the embryo is very intimately connected. That means that your kidneys are very connected to your blood, that your tendons are very connected to your adrenal cortex. So, and I believe I mentioned this last week, but it's worth mentioning again, it's the reason why medical conditions like rheumatoid arthritis affect not just your joints, where people feel the pain from that arthritic joint, but rheumatoid arthritis is an autoimmune disease that attacks all connective tissue in the body. And so that includes the eyes and the kidneys and anything that was created within the mesoderm of the embryo. Okay, let's keep going. So the development of all these structures are as closely related to one another as the skin and the nervous system are, which are both made in the ectoderm. So although connective tissue is continuous throughout the body, it takes on many different shapes and properties and has local qualities that differ widely from one place to another. So it can be as diffuse and watery, or it can form tough, flexible meshwork. In the tendons and ligaments, its tensile strength is superior to steel wire, if you can believe that. It's a fact. In the cornea of the eye, it is as transparent as glass. It accounts for the toughness of leather and the tenacity of glue and the viscosity of gelatin. So you can see it takes on a lot of different properties depending upon where it's located in the body. If you invest it with various degrees of hyaline, which is a nylon-like substance exuded by chondroblasts, it becomes the various grades of cartilage. Invest it with mineral salts and it will become bone. And let me go back on that slide for just a minute, because what that should tell you is that last week we talked about the cell responding to its environment. We can take that connective tissue cell and put it in an environment with mineral salts and get one result. Put it in an environment with hyaline and chondroblasts and you get another result. So this supports what we said last week. So all these forms of connective tissue are in a very active state of flux in the growing individual, with hardenings and dissolvings continually producing changes in the shape, size, and consistency of all the structural members which it composes. This process slows down after we reach full growth, but it doesn't stop. It continues uninterrupted throughout your entire life. Such remarkable versatility and plasticity are possible because this complex tissue is made up of a number of fluid, cellular, fibrous, and crystalline constituents which can alter radically their relative concentrations at different times and at different places to produce very different kinds of building materials. So let's talk about some examples of connective tissue and their most important functions. First of all, and the one that we deal with the most directly, is fascia, which is a thin layer of connective tissue that wraps and compartmentalizes muscle. It is like soft steel wire. It can withstand 6,000 pounds per square inch. Okay, so you're never going to press past that with force. You're going to have to work with it in order to get past it to access the muscle tissue. Cartilage, that's a type of padding that cushions between the bones of the joints. Tendon, I want to take a minute on tendon. We're calling it a separate type of connective tissue that binds muscle to bone, but what I'm hoping you'll be able to visualize is that every muscle cell and every muscle bundle, as well as a muscle belly, are all wrapped in an individual layer of connective tissue. And so when you look at a muscle belly, if you were to take a cross-section of that muscle belly, you would look down and see individual little circles, little groupings of muscle fibers. Those muscle bundles all have their own fascial wrapping. That means there is fascia not just on the surface of muscle, but there is fascia within the belly of the muscle. And when we talk about tendon, what we're really describing is the fascia extending beyond the muscle cell. So it's the strings of fascia coming from the very center of the muscle belly and extending beyond the muscle tissue. And once it extends beyond muscle tissue, we give it a different name, and we call it tendon. And that fascia that we now call tendon attaches to the bone, not with a Velcro. It doesn't just stick on there with a snap. That fascia then extends around the bone and becomes the wrapping outside of the bone. So it is truly one continuous sheet. Ligament is a type of connective tissue that binds bone to bone. So again, we're taking that same connective tissue, the same fascia that held the skin onto the muscle belly, that wrapped the muscle belly, that within the muscle wrapped each muscle bundle, that extended beyond muscle tissue and became tendon, that reached to the bone and became the wrapping around the bone, and now extends between bone to bone, all one continuous sheet connecting the talus to the tibia. Okay, it is all one sheet. They are different properties of ligament, different properties in tendon, and different properties in fascia. However, it is truly one sheet. And then lastly, you have bone, which is the hardest and most compact type of connective tissue, and that provides the body with support and protection. So if we were to draw a continuum of connective tissue, we would put fascia at the end measuring the softest connective tissue, and bone at the opposite end measuring the hardest connective tissue. So softest to hardest, it would be fascia, then cartilage, then tendon, then ligament, then bone. So I want you to think about this, because in your mind, when I say cartilage, I want you to picture costal cartilage, okay, just for something most of us can quickly imagine in our head. The costal cartilage that you can palpate just while you're listening to this lecture feels very hard. It feels very resistant. It feels like it can take a lot of pressure. What I'm telling you is that that is softer than tendon. Okay, tendon is very tough. Let's talk about the characteristics of connective tissue. First of all, connective tissue is made up of very few cells. Remember that I said that cells were the lowest functional, or the smallest functional unit in the body, because the cell actually contains life. So there are actually very few cells in connective tissue. Connective tissue is made up mostly of matrix, and we're going to talk about what is matrix in the next slide. But because there are very few cells, you can make the argument that connective tissue is barely alive. It does have a high concentration of nerves, except cartilage. Cartilage doesn't have many nerves at all, just the nerves it needs to supply itself. And then connective tissue is highly vascular. So that means that the blood vessels move through the connective tissue. So we said skin was avascular. Connective tissue is highly vascular because the blood vessels go through it. So matrix. All connective tissue is made up of two parts, and the two parts are cells and matrix. All right. Within the cells, there are different types of cells found in the different types of connective tissue. And so that's how the body distinguishes whether the connective tissue is going to be bone or fascia. But all connective tissue will have fibroblasts. Fibroblasts are the cell that produces a specialized protein strand called collagen. Fibroblasts are critical for wound healing. And in fact, if you were to twist your ankle and your ankle would swell, that swelling is actually a liquefying effect of the fascia that allows for easier transport of fibroblasts to the region so that the fibroblasts can produce the collagen needed for the repair. So we said the two parts are cells and matrix. The majority of connective tissue is matrix. Matrix is not alive. If you want to imagine what matrix looks like, it's essentially a lot of protein fibers floating in a fluid. It's basically protein and water. So if I asked you, the two parts of connective tissue is cell and matrix, and the two parts of matrix are collagen fibers and ground substance. On your PowerPoint, I've included a slide, a link to a slide or a photograph taken through a microscope of connective tissue so you can really see the collagen fibers. So I want to encourage you to explore that after the lecture. So collagen is essentially a long strand of protein. Its function is to provide support and strength. It is laid down in an area of injury to patch the tear. I already mentioned this. This is why you have swelling after a sprain or a strain. There's an increase in the ground substance or extracellular fluid, which moves more fibroblasts into the area so that collagen can make the injury, patch it up. The sentence that I wrote on the slide, I want to spend another minute with it. I said that matrix, let's go back one. Matrix is collagen fibers and ground substance. And I said that ground substance is the fluid component. In fact, I wrote on the slide it's protein and water. That's not quite true. Water, if you were talking to a chemist, is of course two hydrogens and an oxygen. So it would be more appropriate to say it's protein and fluid. That fluid has a viscosity or a consistency to it because that fluid is containing a lot of elements, a lot of constituents, nutrients that are needed for the production of protein. It's also the transport medium for cells, all cells. So let's keep going forward. Collagen fibers account for more than 1/3 of all animal protein. They are the chief fibrous content of your skin, ligament, tendon, cartilage, bone, your organs, vessels, and it's collagen's tough strands that give to these tissues their shape, their tensile strength, their resiliency, their structural integrity. These fibers can be arranged in any number of ways to produce a variety of properties. They can be crisscrossed randomly in blocks or sheets like fascia, or carefully stacked like plywood, like cartilage, or spun into loose areolar webs, or packed into dense parallel formations like bone. These fibers are not living tissue. They are protein. They're made up of protein chains that are produced by the same living cells that exude the fluid and the ground substance. That's the fibroblasts. When the fibroblasts settle into a particular area, they begin manufacturing and secreting collagen chains, which then, and this is important, thinking back on last week's lecture, those collagen chains respond to the local chemical properties, to the environment, and to the specific stresses in the area so that they can form the appropriate kind of fibers and arrangements. Whether that it's the same, it's a fibroblast is a fibroblast is a fibroblast. When the protein is manufactured by the fibroblasts, depending upon whether or not it's been manufactured in bone, in cartilage, in ligament, and whether or not it's surrounded by chondroblasts or osteocytes, whether it has available the minerals it needs, or what nutrients are surrounding it, determines what that protein is going to do, whether it will become a sac around a muscle, a ligament across a joint, the walls of your blood vessels, the thin, clear cornea of your eye, etc. So ground substance consists primarily of water. Water is found in one of two places in the body, either inside the cell or outside of the cell. When it's inside the cell, intracellular fluid, we call it cytosol, and it suspends the organelles. When it is outside of the cell, or extracellular fluid, we call it ground substance. So take a minute and marinate in that. Every cell is surrounded by extracellular fluid. The term extracellular fluid could be used synonymously with ground substance, meaning part of the matrix, which is part of connective tissue. All cells are supported in connective tissue. Ground substance contains many complex carbohydrates and proteins that give the fluid a viscosity. So ground substance is actually the consistency of either egg whites, which is thin and runny, but viscous, or the consistency like a set Jell-O when it's cold and in a gel state. So ground substance is quite distinct in its origins and functions from other intercellular fluids which seep from the capillaries or other tissue cells. The latter fluids are mostly plasma, nutrients, hormones diffusing from the blood vessels into the cells, and metabolic waste from the cellular activity diffusing back into the capillaries and the lymph vessels. Still all extracellular fluid, still all part of the ground substance. However, they take on different properties based upon what elements, nutrients, hormones, etc. are available in that region. The ground substance of connective tissue, if you want to look just at tendon or just at fascia, is different from all of these fluids. It is the liquid medium through which these other fluid exchanges take place. It's the retort in which all extracellular activities occur. Ground substance is the immediate environment of every cell in the body, and it undoubtedly has a wide range of effects upon every cellular membrane that it contacts. This is significant for you as a massage therapist since you have a profound effect on the ground substance. You're certainly not adding nutrients, you're not adding constituent parts, but you are affecting the quality of the ground substance with each treatment that you give. The chemical activities occurring in the ground substance are legion, and so they also directly influence the passage of all sorts of gases, nutrients, waste, hormones, antibodies, white blood cells between the capillaries and the tissues they irrigate. So if our client has adhered fascia that has become cold and in the thixotropic terms has become gel, there will be less passage of gases, nutrients, and wastes. If you can free that adhesion, you are increasing the metabolic reactions occurring in that region through the effect on ground substance, through warming of the ground substance. I do expect you to know these two equations for your quiz. The equations would be collagen fibers plus ground substance equal matrix. Matrix and cells equal connective tissue. There's a final exam question for you right there. Remember that connective tissue is the matrix and cells, and that the matrix is collagen and ground substance. Okay, so the ground substance really has two particular roles. The first is critical interfiber distance, and the second is transport medium. So when I say critical interfiber distance, I'm describing the space that's necessary to keep the collagen fibers from piling on top of each other. If there's no space, the collagen will actually build upon itself and form a scar. A scar results from too many collagen fibers piling on top of each other, trying to make the area stronger. So before you have a scar, you have an adhesion. So, you know, we grow up thinking that scars are the result of an injury. That's very true. However, if you've ever worked on a body where you felt there was no movement under the skin, everything was so anchored and tacked down, what you were feeling was an adhesion, a lack of ground substance in the region, or a setting of the ground substance, a reduction of critical interfiber distance. So its role as a transport medium, if a person, And so I've used this example again. Let me use a more general, normal example, and then we'll talk about an injury again. The transport medium, again, if the ground substance is in a solid gel state, there is not a lot of exchange of gases and nutrients to the cells that are in that region. The ground substance is the transport medium for the nutrients and the constituent parts of every single cell in the body. So, as a transport medium, if a person sprains their ankle and there's a great deal of soft tissue damage, the body responds by trying to get new fibroblasts into the area, extra fibroblasts, bringing in backup support so that there's enough production of collagen fibers to patch the injury. In order for the cells to reach the area, the body creates inflammation. It makes heat. That heat is going to liquefy the ground substance and bring more fluid into the area. That's the swelling. And with that fluid will come the fibroblasts. So it's pretty brilliant when you think about the body's natural inclination to heal. So the question that should be running through your head is, then why do we put ice on an injury? Why are we interfering with the process? And I'm going to say exactly. Exactly. The body is not meant to be cold. It's meant to be warm. We need that heat. So the only real beneficial reason to use ice is that the body has a tendency to overdo. And when there is excessive swelling in a region, the body experiences hydrostatic pressure on blood vessels and nerves, which then restrict blood flow and nerve signals in the region and can damage tissue. So when the body is overdoing and it's becoming excessive, the swelling is becoming excessive, we do need to interfere with that process. But for the most part, we should not immediately slap ice on something until we see that it's becoming a problem. Okay, so while performing these two roles, ground substance is in one of two states. It's either in a gel state or a sol state. When it's in a gel state, the ground substance is thick like a set jello. The purpose of the gel state is support between the collagen, support for the cells. During this state, the ground substance provides the space between collagen that prevents scarring on a regular basis or adhesions on a regular basis. In a sol state, ground substance is thinner, less viscous like egg whites, and the purpose is transport of cells and collagen to the area of injury. So thixotropy is the term that describes the changing of the ground substance from a gel to a sol state and back again. When you run the fascia as a massage therapist, you're initiating a thixotropic change to the state of the ground substance from a gel to a sol. This enables the fascia to open up and allows for better treatment of the muscle that's wrapped by that fascia. In the human body, the heat, energy, and movement required for appropriately solvent states of connective tissue can be provided by rapid, efficient metabolism. So if you have a high metabolism, then your connective tissue is most likely going to be in a nice fluid state. Physical work, aerobic exercise, stretching, etc. Unfortunately, these are the very things that we gradually begin to avoid as we get older. We become less spry, we become more sedentary, either by nature of our obligations, our jobs, require us to sit more, to move less, to be available at our desk, whereas children are constantly moving. So movement and high metabolism are actually beneficial. It's one of the reasons why our younger clients have less trigger points, less adhesions, less issues, unless they've had an injury. And one of the reasons why you are more likely to see someone who's middle-aged and older getting regular massages. They need it to keep that connective tissue fluid and moving. With disuse, the connective tissue becomes a little colder, becomes a little less energized, and the thixotropic reactions make them gel more They become sluggish. They lose their full juicy quality, their ability to soften, stretch. It also reduces the amount of gas exchange, the amount of metabolic waste that's moved, and so we begin to see more deterioration of the cells that are enclosed in that gel state. R.B. Taylor, an osteopathic physician, states manipulative pressure and stretching are the most effective ways of modifying the energy potential of abnormal tissue. Please note that there's no chemical addition, nothing structural has been added or subtracted from the connective tissue. Instead, by means of pressure, stretching, friction, and the heat that they generate, as well as the heat from a therapist's hand, the temperature and therefore the energy level of the tissue has been raised. This added energy in turn promotes a more fluid ground substance which is more solid and ductile, and in which nutrients and cellular waste can conduct their exchanges more efficiently. Are you getting excited about how effective massage can be? Are you getting the concept of the powerful effect that massage can have on the health of your client? It's very profound. In addition to the mechanical stimulation of pressure and stretching, a powerful thermodynamic effect can be produced upon the bioenergetic field of the patient by a stronger and healthier bioenergetic field of the therapist. This is partly in the form of literal body heat that's being transferred from the therapist, from your touch, from your hands, from your arm, and partly from the more subtle forms of energy such as galvanic skin responses or vibratory rhythms. So if you wanted an argument for does energy work, really create an effect, these galvanic skin responses and vibratory rhythms that we can record in science tell us, yes, actually it can. We do affect each other on an energetic level. So dehydration in fascia, for our clients that allow their body to become dehydrated, and remember we said that the body produces 6 cups of water a day, but it's down by 4 at the end of the day. If you drink anything less than 6 cups of water a day, the fascia will shrink around the muscle tissue. I picture those vacuum seal bags that people use for storage where you put your out-of-season clothes in a bag and attach the vacuum hose to it and suck the air out of it. That's what's happening to your muscles. Trying to release a muscle that has been shrink-wrapped by fascia might well be impossible. By using friction heat from the hands, you can cause the fascia that wraps the muscle to heat up. Clients can maintain the positive effects of their massage longer if they drink enough water to keep their fascia loose, which is something I always educate my clients on. Most clients know that they should drink water after a massage, and most of them will tell you, yeah, we stirred up metabolic waste. That doesn't really resonate with them. When you say, look, you just paid $100 for a massage, if you want these effects to last into the week, you need to drink enough water. We softened up your connective tissue, and it will only stay soft if you stay hydrated. That seems to motivate them. I want to make another point here why I say it's almost impossible to release a muscle that's been shrink-wrapped. Most of us, when we think of diabetes, we think of diabetes mellitus, which is the body's difficulty in managing the sugar levels. If you ever work with someone who has type 1 diabetes or diabetes insipidus, that's actually a problem with the body managing the fluid levels. And their doctors will also often have them on medication that dehydrates them severely. And it can be quite painful for them. Very difficult to work with them. When you're working with them, it's important to note that there is no point in beating them to try and make that muscle lengthen, because the connective tissue has to respond. And while you are adding heat, you are not adding fluid. Swedish is probably the best choice for someone with diabetes insipidus. Okay, moving to the next slide. Tendons and ligaments are a special kind of connective tissue. Their collagen strands are arranged in a parallel pattern. So when collagen strands are parallel, we call the connective tissue regular. Scar tissue, cartilage, and fascia have collagen fibers running in any direction, diagonal, all sorts of crisscross ways. we call that irregular. One of the problems with an injury is that if you tear your tendon that wasn't a regular pattern, the scar tissue will be irregular, meaning it's not going to have the same lengthening ability, the same stretch. You're going to lose range of motion because of that scar. It's because the connective tissue, the collagen fibers, are irregular. So during an injury to a ligament or tendon, the tear will be patched by new collagen strands, but the collagen will not be laid down in a parallel pattern. So the body wants the area to be as strong as it can, so it's laying the fibers down very crisscross, trying to get it at every angle, trying to create as much stability as it possibly can. The client with a sprained ankle will have considerable scarring within the ligament that was torn. Remember that a strain with a T is a torn tendon. A sprain with a P is a torn ligament. So the body wants to provide as much strength for the ligament as possible, but since the injury is less elastic, it is more likely to re-injure. They're more likely to injure themselves again because the tissue doesn't have any give and things aren't moving the way they're supposed to. So cross-fiber friction and collagen. You can use your hand skills to tell the body how to lay down the collagen fibers correctly in a tendon or a ligament. You have to wait at least 48 hours after the initial injury and after the inflammation has subsided. But then if you cross-fiber friction the tendon or ligament, and especially if you follow cross-fiber friction with an eccentric contraction, it signals the body on a neurological level to lay down the collagen fibers in a regular pattern, and that allows for both strength and elasticity. Okay, cartilage. Cartilage is one type of connective tissue that can differentiate. That was one of our 6 life processes. Cartilage can differentiate into bone. So all of your bones are initially cartilage in utero. As the baby develops and muscles begin to contract, the cartilage begins to harden to support the force from the muscle. Infants are extremely pliable because so much of their bone is still trying to harden. In fact, if you take an x-ray of an infant's foot, you will not see anything. You will not see any bone there. Differentiation. Cartilage that is coated to turn into bone releases a chemical that causes the matrix of the cartilage to begin to harden. So while the matrix hardens, the cartilage cells, the chondrocytes, will not be able to receive nutrition. The chondrocytes will die or self-strangulate, and they'll be replaced with bone cells, which are called osteoblasts. It's important for you to understand the types of cartilage. The types of cartilage found in the body are hyaline cartilage, elastic, and fibrous. Hyaline is the most commonly found in joints. It is the pad between your joints. Elastic is the wrapping around most of your organs. Elastic cartilage is what structures your ear, the tip of your nose. And then fibrous cartilage is found in areas that need great strength, like the pubic symphysis, your costal cartilage, the meniscus of the knee. Bone has a lot of collagen and very little ground substance, about 3% ground substance. Any ground substance contained in bone has very hard minerals in it, such as calcium and phosphorus. Let's talk about the functions of bone. One of the primary functions is mineral homeostasis, meaning it takes the minerals needed and supplies the rest of the body with its fair share of minerals. Ever since you were young, you were told to drink your milk to get your calcium so you'll have strong bones, but calcium is needed by every muscle in your body for contraction, predominantly your heart. Your heart has such a high demand of calcium that it has its own sac that's filled with fluid saturated with calcium. So your bones are regulating the amount of minerals available in your body. If you don't have enough calcium, then your body will take it out of your bone. So if you drink a lot of soda, it's carbonated with phosphates. Phosphates actually deplete calcium in the body. So your body is going to continue to use the calcium for your heart contractions and continue to use your calcium for your muscle contraction so you can walk up that flight of stairs or across the parking lot. And if you don't have calcium available, it will take the calcium from your bones. The production of red and white blood cells is a function of bone. That occurs, red blood cells in the red bone marrow. Most blood is formed in the flat bones of the body, like the ribs, the sternum, the scapula, the ilium. And then lipid storage occurs in yellow bone marrow. I do expect you to know the 5 types of bone. All bones can be classified in one of these groups. Long bones, that's what you typically think of when you think of bones, like the femur, the tibia, the fibula, the humerus. Short bones would be the little square, look like rocks, your carpals and tarsals. Irregular bones, anything that looks like an irregular shape, vertebra, facial bones, etc. The sphenoid. Flat bones would include your cranium, your scapula, your sternum, your ribs. And then a sesamoid bone is any bone that is embedded in tendon, like your patella. You need to know the parts of long bones. The shaft of the bone is called the diaphysis. The epiphysis is the end of a long bone. Metaphysis is the growth plate of a long bone. The periosteum is the saran wrap, the fascia, the connective tissue that surrounds the outside of the bone. Remember I said that fascia surrounds the muscle bundle, the muscle belly. It extends beyond the muscle tissue and becomes the tendon. The tendon reaches out to the bone and becomes the periosteum. It is a very important part of bone because that is the place that blood vessels and nerves are located. Obviously, your bone needs a blood supply as well as nerve supply. That is contained in the periosteum. This is another important fact. The periosteum does not cover the articular ends of bones. Any articular point of bone has no periosteum. Since nerves are located in the periosteum, you have very little nerve in joint articulations. Think about that with your clients that have osteoarthritis. The pain that they're experiencing is usually from the soft tissue surrounding the joint and not pain in the joint itself. Even a bone spur is not painful, but the inflammation in the soft tissue surrounding the region is. Okay, more parts of long bone. The medullary canal, or the cavity, is the hollow space inside the bone where the marrow is located. Endosteum is the lining of the medullary canal, the fascia, the connective tissue that's on the inside. And then the articular cartilage, which is the hyaline cartilage that lines the epiphysis where it articulates with another bone to create a pad and reduce friction in the joints. You have 2 types of bone. You have spongy and compact bone. Spongy bone is located in the epiphysis of bone. It is the site of red and white blood cell production. It's called spongy bone because it looks spongy. It looks like there are little holes in it that look like little sponges. Compact bone is located in the diaphysis of long bones. It's very dense, helps the bone to resist the weight that's placed on it. Compact bone is found in all external layers of bone, and it is what makes them hard. Okay, last slide. You also need to know the 3 types of bone cells. You have osteoblasts, osteocytes, and osteoclasts. An osteoblast is a bone-forming cell. An osteocyte maintains the bone cell, and the osteoclast breaks the bone cell down. Okay, that's the end of it. It's a lot of information for next week's quiz. If you have any questions, feel free to text or email me. And if not, I will see you in class next Tuesday.